Good morning, everybody. My name is Cindy Pavel, and I'm here to give my experience, my recent experience with a diagnosis of DCIS breast cancer. And I was told by doctors, several doctors, I was told by friends who had it themselves or they knew somebody who had the simple, easy diagnosis of DCIS, not a big deal, blah, 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 blah. I'm here to tell you, in my experience, that is a load of crap. It has been a problem. It's been a major hassle, several surgeries, several procedures, chemotherapy, and then now they want me to do 5 years of an estrogen suppressant medication, which grossly affects my bone density. As you can see, my hair is struggling to grow back after the chemo, and you're going to be seeing. So, I had to have several different biopsies because from film, right? MRI, which by the way, a breast MRI stinks. So it's not some easy, simple procedure, at least not in my experience. And again, I'm sharing my experience. I'm not saying this is everyone's experience, but this has been mine. And I so just resent the fact that I was told in the beginning, this is not a big deal, blah, 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 blah. And it's been a big deal. So I'm sending this out as a caution that if someone tells you have DCIS, don't worry about it. Like you may be someone like me who has to do a lot of stuff. It's not just some simple lumpectomy and you're done. So I had to see a surgical oncologist, a radiation oncologist, a chemo oncologist. Um, and again, in the last 8 months, I've had several surgeries. I've had a double mastectomy because I had DCIS in only one breast. But they found it in a couple spots. And so that automatically, their road with that is a double mastectomy. Okay, fine. We have the double mastectomy. And then, the surgeon told me oncologist surgeon told me there's only a 5% chance that there's anything else in the breast. It's so low, like, don't even worry about it. Well, I was in that 5%. So they dissect or whatever they do, slices of the breast once they remove it to check it out. And they found several spots of invasive cancer cells. Then we have to go back in. So here I have this double mastectomy. I think I'm all done. I'm in the clear. Yay. And then I get this report. Boom, rug pulled out. Nope, wrong. So then they have to go in to the lymph node. Are they in the lymph node? Nope, not in the lymph node. Oh, now we're in a gray area. Go see a chemo oncologist. So I see her and a second opinion. And they're both telling me that actually she conferred with all her colleagues and she said all her colleagues say I don't need chemo. I've had the double mastectomy. There's nothing in the lymph nodes. Don't need it. However, having a low risk of recurrence doesn't mean no risk. Just because there's a low chance there's no more cancer in my body, it's not zero. So this 12 weeks of chemo going every week is to prevent recurrence. It drops from 15 to 20% down to like under 3% chance of recurrence. Because I am HER2 positive, I'm getting Herceptin along with the chemo. HER2 positive is a protein that feeds cancer. Estrogen also feeds cancer, and I'm estrogen positive. Hence, I did the 12 weeks of chemo, which, by the way, the first probably 2 months, not bad. The last month, absolutely stunk. I could barely move. And then at the end of all that, they congratulate me for finishing the chemo. And then one of the doctors says to me, not many people finish that regimen. Okay, great. Fabulous. Okay. So I've had this poison in my body for 12 weeks. And now I've got another 9 months of Herceptin treatment to target the HER2 positive. To shut that down. Then on top of that, now they have me on an estrogen suppressant medication, which, by the way, affects your bone density in a huge way, to the point where a woman I know who did this regimen for 5 years, she said, these were her words, she felt like crap for those 5 years. 5 years. And, you're on like the emotional roller coaster deal of like going through menopause. I've already gone through menopause. And then, so, and now she has osteopenia because of that medication, the medication that I'm on. So I've only been on it a month. I've already experienced some of those dips. And so what's the point of this? The point of this is, man, write down your questions. Like, do your research. And I go into the doctor, I have a list of questions. And be your own best advocate, because in my experience, doctors give you the overview, but they don't really come forth with specifics. You better know what questions to ask. So go to people who have already been through this. And this has not been a simple process for me at all. So as soon as someone minimizes your breast cancer because it's DCIS, and that could be your situation, it could be that simple. But I am one of those cases where it has not been simple. So I just want this to be a caution for you. I want this to be a wake-up call. Take people with you to these doctor's appointments. Take notes. And be your own best advocate, because, doctors, I mean, I know they're trying their best. I believe that. But you know what? They're not going through it. You are. Anyways, I'm changed forever. That's the bottom line. I'm changed forever. I don't even know if this hair is ever going to grow back as it was. So my name is Cindy Pavell, Pavell. Feel free to comment. I'm also on Instagram under CE Pavell. I'm on LinkedIn. And feel free to contact me. I'd be happy to talk with you or chat with you about this situation, because I'm here to tell you it has stunk. And my life has been changed forever with this no problem diagnosis. God be with you. God bless you. I do know that God is with me. Amen. Okay, how do I end this thing? Oh, there it is.